Well, I think there are several reasons, and probably the most important are the fact that there's been the pathophysiology of this disease has been poorly understood for several years, and now we are getting better in that. We can distinguish different phenotypic traits that we can target with pharmacotherapy. And research for pharmacotherapy has become a little bit more successful compared to the past. Another problem is that there are a few animal models for this disease. And so this has not been a very successful translation from the animals to humans. What has been found in animals not always works for humans, and so we are still struggling a bit in this translation approach. Well, we think that the main mechanism of action is to improve the activity of the upper airway dilator muscle during sleep. So normally, obstructive sleep apnea is a disorder that only happens during sleep because there is a physiologic reduction in the upper airway dilator muscle tone. And this is due to the effect of some neurotransmitter. And specifically, there is a reduction in norepinephrine at the brainstem, and there is an inhibitory effect of acetylcholine on muscarinic receptor. So with these two drugs, atomoxetine and oxybutynin, we basically try to increase the norepinephrine in the brainstem and at the same time to block the muscarinic receptor, so keep the activity of the muscle high even if the patient is sleeping. Yeah, we found that on 20 patients, we performed a crossover trial. They were OSA patients, and they were studied for 2 nights. One night they had the drug, and one night they had placebo. It was a blinded trial, meaning that we didn't know which night was the drug, which night was placebo, and either the patients didn't. So what we found was a consistent, among all these patients, reduction in AHI, and say it again. What we found was a consistent reduction in AHI among these patients, and this was together with the reduction in the desaturation indices, an improvement in sleep quality, especially for those who had the more severe disorder. And this was together also to an improvement in the upper airway muscle activity, dilator muscle activity, that was measured. We measured the genioglossus muscle, which is the most representative of the dilator muscle in the upper airway. And that was the first time that we could find with the pharmacotherapy such a consistent and important effect in all the patients studied. Well, these drugs are approved from FDA, so they already were tested for safety for other disorders, like atomoxetine is approved for ADHD in children and adults, and also oxybutynin is a drug approved for overactive bladder in children and adults also. So these were already tested. The new thing is the combination. We don't know exactly what this drug can do when taken together for many days. So we don't suggest anybody to try it at home or to prescribe, to any doctor to prescribe those, because we are still early in the development and in the study of these drugs. But they are basically already available on the market. And we are looking for in longer trials what might be the most common side effects. We also performed a 1-week trial that showed that the most common effect in the 6 patients that performed it were typical antimuscarinic effects such as dry mouth We found that the typical side effects were those of the antimuscarinic, so dry mouth, especially, and constipation. And there was a person that had some trouble urinating because both drugs can actually give problem. And so this drug might not be helpful or might have more side effects in patients with prostate diseases, for example. And atomoxetine is not recommended for people that have some kind of heart disease, such as heart failure or atrial fibrillation. And this patient could not take this therapy. The main limitation of this study was that it was performed only over a single night of medication. So, and also the small sample size, only 20 patients. So we definitely need to study more people and for longer period of time. We are performing with both industry and academic centers some longer studies, and the results will be available soon. And we are planning to study also other combinations with medication with safer profile, maybe within the same class, and also from other classes.